Welcome everyone, and let's start with the session. So I would like to start by introducing myself. So I'm Dr. Aashna Verma. I'm MBBS, MD Pediatrics, and DNB Pediatrics, and MRCPCH, and also a fellow in pediatric gastroenterology and hepatology. And of course, now I'm a mentor with MedExam MRCPCH. I'm a mentor with MedExam Expert for MRCPCH preparation, and right now I'm looking after MRCPCH Part 1 preparation, especially TAS, right? So uh, let's start with what exactly is MRCPCH. So it is membership of Royal College of Pediatrics and Child Health, and yes, it is a prestigious qualification for pediatricians across the globe, and it plays a significant role in their career development. Now, this exam is one such exam which assesses a candidate's clinical skills and competencies. And, having gone through all the theories and the clinical exam, and, having read so much and having gone and undergone so much rigorous training, you attain a different level of competency in managing pediatric patients. So that's what MRCPCH does to you, right? Now, why MRCPCH? Now, what is the hype all about? So it helps in professional recognition in the sense it's a it gives a high standard of knowledge and competency, as we discussed, and it enhances a pediatrician's CV and professional profile, right? And apart from that, it helps in career advancement in the sense it enables a pediatrician to apply for senior post and to seek job across the globe. The third thing is it enhances knowledge and skill, as we discussed, and yeah, it opens global opportunities for everyone. Then continuing professional development. So it's called as CPD. So it gives you a way to participate in continuous professional development programs to stay updated with the latest advancement in pediatric medicine. Okay, and it also gives you access to some of the ongoing educational resources and also journals and conferences conducted by RCPCH. So that's how you are academically also updated. Then about research and academia, so yes, you will be in a position to participate in researches having done MRCPCH, because it enhances your research skill as well, because statistics is an important part of it. And yeah, definitely your contribution to the healthcare quality would be enhanced. Okay, so because healthcare quality is an important aspect when it comes to especially part 2 MRCPCH and clinical exam, right? Then yes, it is a pathway to UK. So if you want to practice as a pediatrician in UK, you need to do MRCPCH. Okay, so having done that, you are given the post of registrar, and eventually you do training towards becoming consultant, right? And having done this exam, you have to, with that, you have to go for English proficiency tests like OET and IELTS, which helps you get into the GMC registration. Now, GMC is General Medical Council of UK, and once you do MRCPCH, you get fully registered medical practitioners registration in GMC. Okay, so and that's how it opens your door to UK and practice as a pediatrician in UK. Okay. Then what this exam basically comprises of. So MRCPCH consists of 3 theory exams and 1 clinical exam. So in the theory exam, we have foundation of practice and theory and science. This is what comprises part 1 of MRCPCH. And this part 1 exam is conducted in the month of February, June, and October. So it happens thrice a year. And the second one is Applied Knowledge and Practice, AKP. So this makes part 2 of MRCPCH, and this exam again is conducted thrice a year, that is January, May, and September. Okay, so we have 3 exams, that is FOP, TS, and AKP, and you can sit for these exams in any sequence you want to. It's not like you have to appear for the part 1 first and then go for part 2. You can, if you are someone who is into practice since long and you feel more comfortable going for AKP first, then you can do that. You can go for part 2 first and then go for part 1. But at the end of the day, you have to complete all your theory exams to be eligible to sit for the clinical exam. Okay, so we have one clinical exam which is sat only after giving and clearing all the theory exams. Okay, then talking about the exam format. So how exactly the TAS is? So it assesses the basic science, physiology and pharmacology principles. So the questions are a little basic, it takes you back to your anatomy, physiology, pathology related to pediatrics. Okay, and yes, of course, pharmacology, it is a very important part of TS exam. And about FOP, so it assesses a clinical and applied knowledge related to pediatrics and the understanding and decision making skill. Now, about AKP, it's more like FOP, but the questions are a little more advanced. There are layers of question that, you have to solve and then come to the answer. And again, it, assesses the clinical and applied knowledge related to pediatrics. Okay. So, none of these 3 exams are very difficult. They are doable. They are, uh, you know, um, they are tough, but they're rationally tough. Okay, so once you study properly and your concepts are clear, and you have good hold on of basics of pediatrics, you can easily crack these 3 exams. Okay, so yes, about more about the format of these exams. So they are computer-based exam and they're conducted thrice a year, as I told you. And if you're sitting for your FOP and TS together, which can be sat together, okay? So yes, the part 1 exam comprises of FOP and TS, which you can sit together. And if you do that, the FOP is conducted in the morning and TS is conducted in the afternoon session, okay? And AKP is also conducted in 2 parts. So it also has a morning and afternoon session. So it's AKP part 1 and part 2. Um, it's like when you sit for AKP, it has to be sat in 2 different settings. It's like that. So that was about the theory exam. Now, about the clinical exam, yes, you can give it only after giving the theory exam and clearing them. And what you require for giving the clinical exam is, a strong clinical skill and real life pediatric patient exposure. So I have known few of my juniors who are fresh pass out, fresh graduates, and they are thinking of giving the theory exams. They have given theory exams and cleared it. But when it comes to clinical, that is where they get caught. So it is advisable by RCPCH. They have written it on their site that it is advisable to have at least 2 or more years of practice in pediatrics before you appear for the clinical exam, because there you do have real patients. Okay, and you should be in a position to be able to handle them and examine them and come to the you have to have the basic skill to deal with pediatric patients in the exam. Okay, and it comes with practice. It comes when you do it on everyday basis. Okay, so yes, and 3 nights are conducted in UK and in overseas. It depends from country to country, and you require about 6 months to 1 year to prepare for clinical exam. And the prerequisite is that you need to have you need to practice for it on everyday basis. It is advisable to practice it with the partner. Then how to begin preparation of MRCPCH Part 1 exam. Okay. So first of all, you need to have a strong intention. Okay. A lot of people, they keep on thinking and procrastinating that, I'll sit for the exam, I'll sit for the exam. But some also, get into the dilemma of whether to sit this time or whether to sit some other time. And most of us also, think that, okay, we'll do it when the exam booking is done. So, no, that's not the right way. Once, you are clear that you have to give the exam, um, you know, keep it written, write it somewhere, because that is the point from where you need to start, and then there is no looking back. Okay. So, strong intention is the primary thing, and then you proceed with it. Okay. Now, the next thing is to know your exam. Okay, MRCPCH has, has a particular way of asking your questions, and it has a particular way of assessing your knowledge. Okay, so it is important to know the kind of questions that are being asked, and how how the questions are being framed, what topics they're asking, and you know uh, what things they want to particularly you know focus upon. Okay, so they are very clear, they know what they want to know from you. Okay, so you also need to know what they need to know from you. Okay, so that is knowing your exam. You most of you are pediatricians, most of you are practicing, most of you are into busy family life, and like some of you even have your own private practice. So everyone is busy. Okay, so once someone decides to, sit for the exam, I would not suggest to go back to your old pediatric textbook and read it page to page. Okay, that is not the right way of doing it. You needn't revise the entire pediatrics, but do it in such a way that, is good enough for you to sit for the exam and crack the exam. Okay. Right. Now, the third thing is to get your resources right. Okay. We do not need, Nelson, we do not need big books for cracking MRCPCH. Okay. I'll be telling you eventually what books are good enough to prepare for the exam. Then identify high yielding topics and, pattern recognition. So, what do I mean by that? As I told you, there are some topics which are favorite of RCPCH, which they like asking repeatedly. So you need to identify that. How do you do that? There are some previous year's questions put up. Okay, and once you go through them, you will see that you know there are some favorite questions and there are some favorite topics which you need to highlight and write it down somewhere so that you never miss on reading them and solving questions on them and working on them. Okay, because if a question related to celiac disease is asked in MRCPCH exam, it's not a surprising thing. Okay, a question related to cow milk protein allergy, if it is asked in the MRCPCH exam, it's not a surprising thing, because questions related to these topics are asked frequently. Okay, so you need to recognize what topics are being asked, and you need to read them thoroughly. Okay, because I won't say that they repeat questions, but they do repeat topics which they like. Okay, and also do not target quantity. I do not suggest or do not encourage reading too much for the exam. That's not the right way. Even those books that I would be telling you later on to read for MRCPCH, even those books I would not suggest to read it cover by cover. For the first go, you can do that, but then for the second and third reading, I would suggest read only the important topics which you have to mark yourself. Okay. Then one important thing is to make notes. You know, it's important to make notes. I know some of us are not used to doing that, but it comes really very handy during the last 2 weeks of the exam. Okay, in the last 2 weeks when you really need to go through the entire thing of FOP and TS, and have a quick look through all of them, all of the topics that you had prepared since the last 4-6 months. uh, Notes are a boon at that time. So making notes might seem boring in the beginning, but it is really helpful towards the end of your preparation. Okay, and then the last and the most important thing is revision. Keep on revising. Okay, so anything which is read once and not revised might, it may stay. If you have good memory, it may stay with you, it might help you in the exam. But once you revise it, it's so clear, so quick, that once you read the question in exam, you are very quick to decide what the right option would be. Okay, so this way you even save time, and it helps you solve your exam on time. Okay, so revising is a very, very good habit, and I would suggest to at least revise for at least revise 2 times, okay, before sitting for the exam. Okay, for some it might even require 2 to 3 revisions. Okay, but at least revise it 2 times before you sit for the exam. Okay, then some people, they ask me how much time they need to prepare for MRCPCH part 1. So for those who are away from academics since long, I would suggest give yourself at least 4 to 6 months, 4 to 6 good months to prepare for the part 1 exam, because the initial few months also are taken up in getting adjusted to reading, because most of us are away from it, we are into practice, so it becomes difficult to get back to it. So give yourself some relaxed first 1.5 month. Okay, and later on you can get up. And to those who are new to pediatrics, I would say please take good 6 months or even more than 6 months, because for those who are, completely new to it, new to pediatrics, and MRCPCH is your first thing related to pediatrics that you're doing, then please take good time in hand, because then I won't suggest you to, read less and crack the exam. I would suggest please read the books properly, clear all your concepts related to pediatrics, and and uh, read it in such a way that you want to know pediatrics. Okay, and not just clear exams. So for the newbies, take a good 6 to 8 months and read thoroughly all the books, and then sit for the exam. Okay, okay, right. Now about FOP and TS format. So there will be around 100 best of 5 single best answer questions in each exam. So FOP 100 and TAS 100. And each question will be worth 1 mark. And the time allotted for the exam will be, 120 minutes. Initially, it used to be more, and now it is 120 minutes. And initially, we used to have a different, pattern of question, that is EMQ. Now it is not there. You need not know what it is, but do not worry about the change in format. They are not going to make it tougher, but this is just to make the pattern of exam uniform. And this is this is one such format which is being followed across the world for most of the exams that are conducted. So just to standardize the way of conducting exam, they have done this change. Okay. Okay. And yeah, so the time allotted to you is 120 minutes, which is not very less, but then you need to be, quick in solving questions. Okay. So 100 questions, 120 minutes, and at least keep a gap of, keep at least 5 minutes, last 5 minutes free for yourself. Okay. For those 5 minutes, just keep it in such a way that the marked some, there are few questions which, you feel like going again and reading and deciding which is the correct option. So keep those 5 minutes for some particular 4, 5 questions which you feel you need to revisit and see, and maybe take proper decision of which option to mark, right? Okay. Okay, so this is one very frequently asked question, if to sit for FOP and TS together, or to sit for it separately. So most of the times, to my uh, to all the people who ask me this, I give them, the scenario. I actually give them this option that if they feel that, they are away from academics since long, and that they need to go a little slow and make it one by one, it's okay, you can do that. But the thing is, the syllabus for FOP and TS is quite similar. Okay, it is just that the way of asking question is different. So I myself would prefer sitting for both together. Okay, but yeah, if you do not feel confident and you feel you need to give some time to yourself, you can just sit for them separately. Okay, but as such, if you are if you feel uh, even a little bit of confidence, you please sit for both of them together. Okay, it will save you time, and it will save you some money also. And also, you'll feel that ultimately preparing for FOP and preparing for TS is quite similar and not really different. Okay, then about what all topics are being asked. So this is a list of topics that are being asked in both FOP and TS. So the syllabus is same for both. And yeah, so this is it. But most of the time when we do our training in pediatrics, we miss out on few topics like safeguarding, ethics, palliative care, and pain management. So these topics are given importance in MRCPCH exam, and that's where we fall little short of. Okay, so it is important to not ignore these topics and do them well before sitting for the exam. Okay, then talking about useful resources for TAs. So clinical cases for MRCPCH theory and science, which is given by the RCPCH itself, is a book comprising of about 50 questions, okay, which are beautifully framed questions, and they have um, excellent explanation given behind them. So this is one book which I really love, and I must say that one has to read it. And before sitting for the exam, this is one thing which you need to do, and uh, then sit for the exam. Then comes Science of Pediatrics, which is again a book by RCPCH. So this book is also a lovely book, and it's okay if you do not have time. I won't tell you to read it cover by cover. That is not even advisable. But all the important topics and high-yielding topics have to be read from Science of Pediatrics for TES exam. Okay. Then comes RCPCH sample papers, which are available on the RCPCH site. They are important. They, give you an idea of how the questions are framed and how lengthy the questions are. So once you look at them, you understand how much time is consumed by each question. Okay, so this will help you manage your time in the exam. Okay, so yes, that's about sample paper. And then comes past recall. So previous year's questions are important to solve. And how much old question should you solve? I usually suggest last 4 to 5 years questions are enough. Okay, and if you have limited time, make it last 3 years, and you should be good to go. Okay, so previous year's recall is a very important part of preparation, and but do not miss take those recalls in such a way that the questions are being repeated. I would again keep on insisting on the fact that please use it in such a way that you understand what is important, what topics are important, and how the questions are being asked, and not really mug up the recalls and think that it would be in the similar way for your upcoming exam as well. So just take help of recalls in such a way that you understand important topics and read them from the books and prepare yourself accordingly. Okay. Then comes a pharmacology file and ethics file. So there are some files which are circulating on the net, and also we have it on our website, which are important resource for TS exams. So they are separate comprised files for pharmacology and also ethics. Now, talking about useful resources in FOP, we have clinical cases for MRCPCH Foundation of Practice. Again, this book is by RCPCH and it has 50 questions, and the explanations are also given behind each question, and it very nicely clears your concept regarding the topic which is being assessed and asked. Then comes Science of Pediatrics. Again, it is an important resource for FOP, and Illustrated Textbook of Pediatrics. So Illustrated Textbook of Pediatrics is again an important book, especially for FOP. You can use it for TS as well, but for FOP, it's a very good book. Okay. And as I told you, that important topics, read to need to be read nicely from textbook. So if you suppose highlight a topic like today I'll be reading precocious puberty, then make sure that you read it from Science of Pediatrics and Illustrated Textbook of Pediatrics, both. Okay. If you have time, make it both. But if you have limited time, stick to one book and make that as your core book. Okay. Then for FOP, you need to read pediatrics guidelines and neonatal guidelines, and also NICE guidelines. Okay. I won't say that you have to read all of them, but there are some important ones which you cannot miss out on. Okay. Then RCPCH sample paper, again for FOP, is very helpful to know the kind of questions and the length of questions being asked, and again previous recalls. And past this is something which I would keep a little low on the preference list. But yes, for FOP, past test is something which is used by most of the people, and it comes out to be helpful for them. But to be honest, I did not do past test, and I didn't feel that I fell short of any resource, okay, without it. Okay. Now here I have put up one question so as to share with you what kind of questions are being asked. So this is from clinical cases of TAS, and the question is that a baby is born with abnormal external genitalia, which you suspect to be very virilized female genitalia, as there are no palpable gonads. Birth and antenatal history are unremarkable, and there is no significant family history. You know that congenital adrenal hyperplasia is a likely cause of such a presentation. Okay, so they have given to you that child that you're dealing with is a case of congenital adrenal hyperplasia. Now, what they want to know from you is which of the following are the most relevant immediate diagnostic tests, right? So you understand the kind of question that is being asked. And as I told you, this has been taken from your clinical cases. So, again, it has 5 options, out of which you have to choose the best option. Okay. So because I have showed you this question, let me, just complete with it. So the option says you have to go for karyotyping and 17 OHP, that is 17 hydroxyprogesterone levels. And both have to be sent after 72 hours is the first option. Then karyotyping and 17 OHP both sent immediately. That is the next option. And then you have karyotyping and imaging of the adrenal glands, karyotyping and sequencing of the CYP21A2 gene, and karyotyping sent immediately, followed by 17 OHP after 72 hours. So what do you think is the right option here? Anyone?
Hello?
Hmm.
Hello?
Yeah.
You send karyotype directly and send 17 hydroxy after 72 hours.
Okay. And can you tell me the reason for that?
Actually, it is not for karyotype, we can send it directly immediately after this, but for hydroxy 17 hydroxy, so no need to send it directly. We can wait even after 72 hours to send it.
Okay, definitely we can send it after 72 hours. But why do you think we cannot send it immediately, 17 OHP? Parents would be, behind you asking you what is it and, why is it so? So you wait for 72 hours, there has to be a reason for it. What is the reason? Your answer is absolutely right. You have to send karyotyping immediately, followed by 17 OHP after 72 hours. So E is the right option. But we send 17 OHP after 72 hours because after childbirth, even before childbirth, when the labor process has started, the adrenal activity is at its peak. Okay, so the as you know, the adrenal gland secretes hormones, which also helps in the fight flight situation. Okay, so when the body is under stress of labor, both of mother and the child, the adrenal gland becomes very active and it secretes lot of corticosteroids. It secretes, you know so much, it has so much elevated secretion from the adrenal glands that even if you get it done immediately after birth, the level of 17 OHP may be falsely high. Okay, because of the so much metabolic hyperactivity of the adrenal gland. So that is why we usually do not do it immediately after birth, and we wait for 72 hours for the level to normalize and get back to its baseline level if it is a normal child. Okay. And about sending karyotyping immediately, we do it because the karyotype won't change, even if you do it immediately or after 72 hours or even after a week. And we have to send it because we have a child with ambiguous genitalia. You do not reveal or tell the gender of a child with ambiguous genitalia without the report in hand. So you have to send karyotyping immediately to be in a position to answer parents about the gender of the patient. Okay, so about the explanation, the diagnosis of CH is made with a high random 17 hydroxyprogesterone level, which is also a screening test for congenital adrenal hyperplasia. And as the fetal adrenal is very metabolically active, um, 17 OHP and other adrenal metabolites are normally high in the fetus and in the first few days of life. So the results can be difficult to interpret in the first few days of life. That is the reason why we differ 17 OHP level test after 72 hours. Okay, so I hope this is clear to you, right? Right. So about preparation in the last 2 months. So for all of us, last 2 months are very, very important. Okay. And especially for people like me, I started preparing late, and also until my last 2 months I used to procrastinate a lot, and my study was not full-fledged. So last 2 months are for everyone, for every candidate, it's very important. So it is important also to make it right. Okay, to do it in the right way. So what you have to do in the last 2 months is you have to read notes. Okay, you have to make notes and you have to read notes. I'm sorry, I'm insisting a lot on notes because it has come really very handy for me and for people, around me whom I have known and whom I have taught. So please believe me when I say that making notes helps a lot. Then focus on high yielding topics. Okay, focus on the high yielding topics only in the last 2 months. There is huge pediatrics is huge. Okay, if you keep on reading it, you can read it for years, right? And we have training of pediatrics of 3 years, so it's not possible to read everything in given 4 months, 6 months. So make sure that you read only high yielding topics in the last 2 months, and don't forget the importance of revision. Keep revising at regular interval. Do not wait for finishing up everything and then revising. You can even do it this way, that you are done with 5 topics and you are going to start with the next 5 topics. But before that, you can have a quick look at the 5 that you have already done. So that is also counted as revision. Okay. So you can do it this way as well, rather than, finishing everything and then only revising. Okay. Then invest half of your time in studying and half of your time in solving questions. This is for last 2 months. For people who start preparing, suppose you give yourself 6 months to read, then in the initial few months, it's not advisable to solve a lot of questions. Okay, it's more advisable to read and make form good concepts in your mind, right? But when it comes to the last 2 months, make sure that you equally divide your time in studying and solving questions, because you need to know how to apply the knowledge that you have already acquired in solving questions. Okay, because if acquiring knowledge thing is done well, but the application part is not done well, then there will be problem. Okay, because at the end of the day, your exam is a computer based multiple choice question exam, and unless you are good at doing that, unless you are good at solving questions, um, it will be difficult. Okay, so make sure that you study and also you solve questions. And you can even do it this way, that I used to um, do it both the ways. I used to study, solve questions, and sometimes when I used to get bored and I felt really monotonous, then I used to solve questions and then go back and retrospectively read a topic. Okay, suppose I solve a question and I
Dr.
did not understand
Aashna,
it.
do you
Yeah.
know how important it is to have a buddy or a study partner, or is it
So
okay to sit and read alone? Is it
it's
very
okay.
important to have a study partner?
No, I did not have any study
You do
partner for
have.
my theory exam.
Okay. Okay,
Okay,
fine. Okay.
so it's a study buddy is not a modern thing for it's not at all a thing for theory exam. You have to do it yourself. Yeah, if you have someone who is preparing with you, it makes easy to discuss things. But that's fine if you do not have it. Okay, because most of the times we are out of our colleges while we are preparing for MRCPCH, so it's difficult to find people around. But it's not an important
Yes.
thing when it comes to
Yes.
theory exam.
Okay.
It becomes
Okay.
important for clinical because you need to practice with each other, right?
Yes.
So don't be worried at all about partners. I had no study partner for any of my theory exam. Okay, so yeah, as I told you, whenever you feel monotonous, you can change your study pattern. You can solve questions and then go back to the topic. So that also helps. Okay. Then manage your time well. Keep selected slot for study time during the entire day, and make sure you study during those times. Okay. Then recalls are important and must do. So when you start preparing, and when you are in the initial few months of preparation, I won't suggest you to pick up recalls in the initial part of your prep. Okay, but recalls are really really must do in the last 2 months. Okay, because it again guides you towards the important topics, high reading topics, and it channelizes your energy into what has to be done. Okay, because recalls are a pathway or a gateway to understanding what kind of questions are being asked. And uh, uh, believe me, when you solve recalls of last at least 2 to 3 years, you have a very clear picture of how to do your rest of the study. Okay, that is in the last 1 month, 2 months. Okay, and it is helpful in the revision also. Like you need to revise this and leave that, and all that. So recalls are important, and identify your weak areas and supplement that with more reading. Okay, as I said, you have two good books with you, Science of Pediatrics and Illustrated textbook. So if you feel that you are not good with a topic, suppose maybe it's congenital heart disease, which I find a little difficult, then I read it from Science of Pediatrics and then I read it from Illustrated textbook. Okay, so that is how it helps me, and then I go on to solve questions related to it in clinical cases of TS and FOP. And then I solve questions, system wise recalls of CVS. So this way it helps me, uh, come over my fear of congenital heart diseases. Okay. Now, okay, one more slide on how to apply for the exam. So for the upcoming February exam, the bookings are open, and I guess for most of the places, the seat must be booked by now. So I'll just quickly, tell you that you need to create an account in the RCPCH. You need to have an RCPCH number, and then you need to register for with the RCPCH. It is free of cost, but you need to do it beforehand because it takes around 15 days to 1 month for them to approve it. Okay, they might sometimes do it early, but at least keep a good safe time in your hand, at least of a month before the booking starts. Okay, so you have registered and then comes the booking date. It usually opens 2 months before the exam date. And yeah, this is when you have to, book for your exam slot. It is a first come, first uh, basis booking. So you need to be really quick with your, um, computer things. Okay, your system and network need to be very strong and in a good condition. Okay, then this given here is the RCPCH site, which is a very very good site. Okay, you once you go through it, you will understand. They have given everything. They have answered all your questions there. And even if you have any doubt, you can write to them on their official email ID. They even reply to you. They take some time, but they do reply. Okay, so it's a lovely site. You can go there, and there are a lot of FAQs being answered, and it's a good one. Okay, for someone who is completely new to MRCPCH and you do not know anything about it, and you do not have anyone to guide you, this site will. Okay, this is where I have seek most of my help from. Then a big disclaimer that do not wait for exam booking to start your exam preparation. Okay, it would be too late. For some people, I have known they wait that if I'm done with the booking and if I get a slot, only then I'll start preparing. No, my dear, it would be too late to prepare. Okay, so you need to prepare beforehand. Right. And finally, on exam day, how to attempt questions. So you need to read questions carefully, pick up the key words. There will be a lot of distractors, okay? Distractors in the sense they'll include a lot of statements which might not be helpful in, finding the answer. So you need to focus on the keywords. Do not miss out on words like except, for, false, true, etc. Okay, keep a track of time, divide your exam questions into slots. Okay, that for the first uh, you know first 25 questions I'll solve in this time, next 25 in the later time, and so on and so forth. Then believe in your first instinct, avoid making changes into your answers during second check. Okay, a lot of us have this habit of changing answer when we, changing options when we go through our paper again. Okay, but I would, based on my personal experience, I would want to tell you that believe in your first instinct, because that first instinct comes from, your subconscious mind. You have read some day before, and you might have read it sometime before, and you might not be able to recall it, um, you know instantaneously, but somewhere it's there in your mind, okay, which is coming out in the form of your first instinct. Okay, so go with the drive, and avoid, changing your options multiple times unless you know that you have marked the wrong option. Okay, then keep yourself hydrated, but do not drink a lot of water. Okay, it might help you wasting time. And take deep breaths in between. Okay, stay calm, stay relaxed. And it is the day when you need to perform. Okay, whatever you have done, all the hard work that you have done, you need to put it all on the, that day of performance. So stay calm. Now, okay, so about the session, I'm done with the session, and actually, this is our crash course features. Okay, so with all that I have told you till now about how to prepare for the exam and how to go about it in the last few months, this is how we help you with our crash course. We help you in making notes, repeatedly that I was telling you to make notes. We help you in doing that by giving you, live sessions, and it in it the basic thing of reading important things and highlighting things. We help you get it done. Okay, we do the homework of finding the important topics, and we do the homework of going through recalls and understanding what is being asked and what can be asked. Okay, so we do the homework, we keep things prepared and present it to you. Okay, so that is how, the things get easier for you in this in the course that we conduct. Okay, and in the crash course that we have for February 2025 FOP and TS exam, we provide 4 recall discussion live session and 2 live session for recall workshop, 16 topic wise sessions recordings. Okay, and live session recording, previous recall recordings, and PDFs of all the sessions that are, conducted. Also, we give you solved recalls of the last 5 years, and also you have the facility of mock exam. Now, when it comes to mock exam, I would want to tell you that please appear for mock exam, because it is important to, you know have have given it is important to give an exam which which is similar to the actual exam that you're going to give. Okay, because when we solve recalls, the questions are really short. They do not, they are little misleading, in the sense, in the real exam you get questions which are lengthy, and it requires some time to read and go through it and pick up keywords. So it is always a good practice to go for mock exam before appearing for the real exam. Okay, and that helps you in strategizing your D-Day. Okay, then comes about the question bank. We have about 3,000 questions in the FOP and 2,000 questions in TS. Okay, and we have all the available resources which are required for FOP and TS preparation, all the books and all the important files. And definitely we have the study group discussion where you are given questions every day to solve, which keeps you on track. And yeah, any doubt we can discuss on the group as well. Okay, we are there for you, right? And yeah, that's from my side. So for any queries, if anyone has, please feel free to ask. Okay, Dr. Fatima. I guess you have sent this thing in the chat that it's karyotyping and 17 OHP both sent immediately. Okay. Yeah, but the explanation that you have given shows that it should not be sent immediately. So and there should not be any confusion. Please understand that 17 OHP level has to be sent after 72 hours of birth and not immediately. And I have explained the reason for it. Okay, so any doubts, any queries related to preparation or the course or anything?
I'm asking Dr. Aashna about this crash course. This is just before exam or what? How to? For if I have any difficulties in some topics, I need to more help. I mean, yeah, personally, I face problem in genetics sometimes. I have confusion in genetic and some endocrine problems.
Okay. Okay. So did you have a read of it from the Science of Pediatrics?
No, not from the science. I read from revision notes actually.
Okay, so you just have a read of it from Science of Pediatrics. It is very nicely given there, and they have covered most of the things which is actually being asked in MRCPCH exam. Okay, so I would suggest just go through it once, and most of the questions which you see in the recall, most of the questions that you see in clinical cases and sample papers, you would be able to solve. Okay, having read that.
If I can find, this is online. This is book Science of Pediatric and the others clinical cases. It is available online because actually I tried to download online, but I failed.
Are you a part of our regular course?
Sorry? Yeah.
Achha, you are a part of our regular course, right? So you can go get that from our website. We have it
Website.
on our website. Yeah.
Okay.
MedExam Expert website you go to, and then there we have all the PDFs available.
Okay.
Yeah. So all the resources that I have enlisted in my slides, all of them you will get there, and many more. Okay. You have like huge resource available there.
Okay, thank you so much.
Yeah. You can take help of our coordinators. They'll guide you how to, find those PDFs in the website.
Okay. But also I want to ask about the session. Actually, I miss one or two session, a live session. I don't know what the recorded session is.
Nothing to worry. Please go back to our recordings. You have the recordings available with you.
Okay, thank you so much.
Yeah, and in that, if you have any doubts, let me know.
All the books are available in the downloadable folder in the dashboard. You can check. Yeah.
Okay, thank you so much.
Yeah, Dr. Aashna, I just wanted to ask, in the question banks, these questions are from the past test or the 3,000 and 2,000 questions, no, in the question bank?
So there are a combination of questions from there, and it's a combination. It's a
One
pool that has
examination.
been prepared from different books.
Okay.
Yes, I have another question, Dr. Aashna, regarding the past test. Actually, I have before MRCPCH FOP-TAS books. Did
Okay.
you think this is useful to read it, yani, as revision?
Okay. So, Doctor, are you appearing for February FOP and TS, or you'll sit for later
February.
exam?
February.
Your booking is done.
Yeah. خلاص
Okay.
confirm.
So I would suggest if you have done your reading part, studying part, then only open those past test questions and solve. Okay. Otherwise, if you are still, you are yet to read topics, then there is no meaning of going for those questions for now. But still, if you want, you can practice FOP questions from the past test book that you have, but not for TS, please no.
Okay.
Yeah.
Okay.
And if by end of this month, if by end of this month or by mid-Jan, if you're not able to complete most of your reading content, if you're not able to finish that off, then please leave that book. It's not mandatory to clear the exam. It's not.
Okay. Thank you so
Yeah.
much.
Okay, fine.
Okay, so yes, that's a good question. So the right time to take it is at least uh, 21 to 15 days before your exam. Okay, so that you
Okay.
have some good amount of 2 to 3 weeks in hand to improve with the mistakes that you do. Okay.
Okay. Thanks.
Yeah. Any more questions? Okay. So yeah. Bye-bye. Thank you everyone for your patient listening. Okay. All the best.
Goodbye,
Bye.
Aisha.
Yeah.
Thank you so much. Thank you.
Yeah. Thank you.